treatment abroad scheme is extremely specialised. It is only for treatments that are not available in Ireland. There's one exception to that, but we're not even going to go there today, okay? So it's only for treatments that cannot be provided in Ireland. So when your consultant decides a patient needs treatment abroad that's not provided in Ireland, either the consultant or the patient requests an application form. The moment you request an application form, we take your details. You're logged at every point of contact you make with the office is logged. We record it, not on phones obviously, but the girls take notes. We know who we've issued application forms to and when, and we would know then if that person sent back in a completed application form. We do not process an application form that is not complete. It just cannot be done, okay? The information we ask for on the application form, we need it in order to make sure that the applicant qualifies under the treatment abroad scheme. Are they an Irish resident? Are they a public patient? Now, you could be a private patient and apply, and if you do, we will send you back. We will send you away. We'll say, go back to your private health insurer, see will they cover it, and if they don't, come back to us. We don't get private patients to go back into the public system, but we ask them to access their private funding if they have it in the first instance. If there's a shortfall between the costs and what their private insurer will pay, we will pick up the difference, okay? Or if their private insurer won't cover it at all, we will look at it then, okay? You'll be treated exactly like a public patient. When an application form comes in, we give ourselves 20 days to process it. The reason it takes so long, and it doesn't, in fact, we usually turn them around in the space of a day or two, but we give ourselves 20 days because when we get an application form, there are certain parts of that application form we will send to a medical advisor. And if that medical advisor was on holidays or anything for 10, 14 days, that's why we need to specify 20 days. So inevitably it will take us a day or two to turn one around, but we give ourselves the leeway in case there's anything outside our control. Then you're issued with correspondence in writing, and in writing only. The staff in the office are not allowed to tell you anything over the phone, and that's as a response to an ombudsman ruling. The only thing we are allowed to tell you over the phone is how many days are left before we can give you a response. Okay, so if you're wondering why, and that you'll see that it's written in the letters that we can only tell you this. That's the reason why. It's because of an ombudsman ruling. So then, if something is declined, you have an opportunity to appeal it. If the decline is upheld on appeal, you can appeal it further to the ombudsman's office. Okay, and that's basically the treatment abroad scheme in a nutshell.
We want to have a follow-up for several reasons, because first of all because of the patients, but then all our lutetium treatments are given within a study, and according to that study protocol we have to follow the patients after the treatment. And it's a special schedule. It's 3 months after the last treatment and then every 6 months. Of course this is because of the study protocol, but it's also because we want to develop the treatment to find the best way to treat the patients and improve it more and more. And in order to do that, we need this follow-up. And I can also tell you, as I said, this is given within a study. So when you come to Uppsala and you're accepted for lutetium treatment, then you are offered to sign this study protocol. But this is a democratic world, so you can refuse, but then you will not have the treatment. I just tell you, because we are not allowed to give the treatment outside the study because of the authorities.
Yeah, and I think
but it's no difference for you. This treatment is the same. No one receives placebo. Everyone receives the active treatment. So it's just a form to fill in, but you have to do it.
Yeah.
And you have to accept that we use your data for research and follow up. There's one problem with Rotterdam, and that is that they give 4 treatments by lutetium fixed. We have a dosimetry protocol. That's why you have to stay longer the first time, because we have found out, we haven't published it yet, but we will publish it, that patients who can tolerate more than 4 treatments, and about half the patients can do actually benefit from receiving more treatments.
Really, at the time?
In a row. At the same time, we
Yeah.
give it every 2 months, like as they do, but we calculate the renal dose, and if the patient tolerates it, the renal dose, and the bone marrow is not impaired, the bone marrow function, then we try to give as many treatments as possible, because we believe that patients who receive the maximum dose, the maximum activity, have a better effect. Of course, that's your physician who has to send you to the center he prefers, but that's the advantage by coming to Uppsala.
They are approved for what's on their application form. So if your application form says for one assessment, if like you take children going over for a paediatric liver transplant, we will say to the consultant, for God's sake, will you put down the assessment, the surgery, and one follow-up? Because otherwise they're going to have to go back to you 3 times. You're going to be stamping on the floor about filling out forms, and we can do nothing because you only applied for one thing. So it's down to what you write on the forms.
Get in contact with Uppsala Care. Let them help you with the arrangement. They are very good. We are very happy that they have started that unit, because previously we had to do such work ourselves, our nurses. We had to take care of the finances. They assist you with hotels, traveling, and so eating, and so on, where to go. And so I really would tell you that to keep in contact with them. And if you're sending scans, for example, after the treatment, send them to Uppsala Care. If you are staying, as you said, an extra day, then you should go to Stockholm, because Stockholm is only 45 minutes from Uppsala. It's a very beautiful city, if you have time.
Everything the HSE does is governed by legislation. 1970 Health Act, 1994 Health Act, and so on and so forth. Everything a public service does, and that gets lost sometimes in the media coverage, okay? We cannot do anything outside of legislation. In the regulations that cover the children's abroad scheme, there is no allowance. We do not have to pay any travel or subsistence. We're not prevented from paying it, but we don't have to. The function of the HSE is to pay for medical treatments. It is not to fund travel or subsistence. Saying that, when in 2012, starting in 2009 until 2012, we decided to centralise the treatment abroad scheme, because it was being administered differently in different old health board areas. So we centralised the whole thing, and we introduced a national travel policy, and that allows for your airfares only, and the companion airfares if your doctor recommends that you need a companion to travel with you, and that's all we cover, nothing else. And that's the reason that it is so important that you do not pay for hotel expenses while you're in Uppsala. They must appear on the invoice from Uppsala, or else we cannot pay them. As far as we're concerned, Uppsala are making the decision to use a more cost-effective overnight stay for you, as opposed to invoicing us for inpatient care. So they are paying and we are paying them, okay? And that's why it has to come in that way. It is pragmatic from where all of us are standing, okay?
I usually recommend all patients who are coming for treatment to have an open ticket for their traveling home, because you don't know if there are complications. Of course, normally there are no complications with lutetium treatment. No, most patients tolerate it, they go home, they take the scans, everything goes fine. But if something should happen, it's great to have an open ticket if you have to prolong the stay for a day or more for some reasons.
With us, if something happens that you can't go home the day you're supposed to, okay, the patient can either book a new ticket, or else they can try and get the one they have for a new date, and we cover the cost of that. That's
We
not a
do.
problem, so long as we know that it was down to yourselves as opposed to the patient deciding, well, I'm going to spend a couple of days here. Let's say you go to Uppsala and you have treatment and something goes wrong while you're in treatment and you need to come home. Yeah, we organise an air ambulance. But let's say you're over there and you have your treatment and you decide to stay on for 2 or 3 days and you go skiing up the mountains or something, or you go driving, or you have an accident of some description. Again, your EHIC form will cover you while you're having the treatment, but it's the getting you home part that can be that's the crux of it.
I mean, my opinion is that all patients are, of course, welcome for a second opinion. But as you say, we need a referral from your physician in order to have the payment. You can have a consultation in private if you want. Uppsala Care accepts private consultations, and we accept it. But we are very happy not to see patients not only for lutetium treatment, but also for second opinion, for general consultations. If you have a neuroendocrine tumor, you are most welcome to see us.
When you come to see them for second opinion, so it's very important for the doctor if you send the last medical report, blood samples, or if you have a CT scan or PET scan, wherever, and especially the pathology report, because it depends.
And pathology specimens. We want.
Yeah. Precisely, the key 67 is important for your shows for treatment. So I think it's very important to.
Very interesting point.
But send it to Uppsala Care.
Yeah, so we can help you.
If you get an appointment letter from Dan, say an annual recall, don't contact us with it. You must go back to your referring consultant in Ireland. I cannot take a referral from Dan because he's not in Ireland. He is not an Irish-based consultant. I can only accept them from Irish-based consultants. So the first port of call when you've got an appointment letter is your Irish-based consultant. Get him to fill out the form or email us, and then we'll work from there. In most cases, the VHI and all the other private insurers use exactly the same criteria as we do to qualify you. They will say, if it's available here in Ireland, we're not paying for you to go abroad. If it's not available, they will pay. They draw the line at certain outpatient therapies, okay, and that's where you can run into trouble with them. But once you get a letter from them saying that they will not fund you, we will then process an application form. But if we think you are private, and from time to time we change our application form, and we change it for different reasons. We come up against things. One of the things we do now is you will tick a box to say, yes, you have permission to look at my medical records. And the reason we're doing that is because patients were presenting themselves as if they were public, when in fact they were private patients attending the consultant privately. As a private patient, you have no entitlement to public health care. Okay, you have no entitlement to funding from us. So, like I said earlier, what we do is we do not say, go away, we want nothing to do with you. We say to you, go back to your private health insurer, check and see will they fund you or part fund you, and we will either pick up the balance if they will only part fund you, and if they won't fund you, we will process you like a public patient, and we will not insist you go back into the public system. You can still continue to attend your consultant privately. But we will try and maximise our funding. Our job is to protect public funds, and that's what we will do. If you've got private health insurance, you can opt not to use it. You have a right to be a public patient, and you do not, even if you continue to pay your premium, you do not have to use your private insurance, but you must make your option before you start. Now, you can be halfway through and decide, no, I want to be a public patient. You know, I just can't afford to continue paying for outpatient treatments and outpatient consultations with my consultant, and you can opt to go publicly. But there is nothing to stop that consultant making you go back to the beginning of the waiting list. You cannot use private health insurance to gain priority access. That's the key.
I think the key
If you want a consultation, we prefer seeing the patient, not only the scans, the pathology reports and so on. We prefer seeing the patient because then we have a much better possibility to give correct advice. So we really prefer seeing the patients. And we have a pretty short waiting list for consultations.
Oh, you're all part of the treatment abroad scheme. There is another scheme called the Cross-Border Directive that came into law on the 1st of June. This one you can use in a situation where the treatment is available here in Ireland, but you want to go somewhere else to have it. Okay? So what you could do is you could go back to your GP, get a referral for an outpatient assessment to Uppsala, and you can head off to Uppsala. You won't get your travel costs, and you will be reimbursed to a maximum of €130. Okay. I presume you're accepting cross-border directive applications, and that would mean you would be over there as a private patient. Okay, so you'd foot all the costs yourself, you would have to have a referral, and you would only be reimbursed when you come back and show that you've paid. Okay, so that's the other alternative. Not necessarily one I'd recommend for neck patients. Okay, and don't use it. Don't even attempt to use it for something that isn't available in Ireland. It won't qualify. You only qualify if it's not available in Ireland under the treatment abroad scheme. The two do not overlap. You are better off being known and in the care of the relevant consultants here in Ireland. I would rather see...
But you could use it for a second opinion.
You could, but I would rather see the consultant treating the patient here in Ireland refer the patient down under the treatment abroad scheme for an assessment with a view to treatment, as opposed to using the cross-border directive. You have to remember the relationship between patients and consultants, and we come up against this quite a bit, is a very personal relationship. And any breakdown in trust, if you can avoid it at all costs, I would. These people are handling your lives. And to keep information flowing and keep the relationship as open as you can is a far better way to be working. I mean, it's there and it's usable, but just think what's best in the long run for all of you, and is there just a little bit more open communication with your Irish consultant? Would that be what you need just to swing this under treatment abroad scheme?
That's what we prefer too. We prefer a cooperation with your consultant, a referral from your consultant. We're very happy to see you as a patient, but we prefer the open communication and the referral from the consultant and a cooperation, a cooperative atmosphere, if you understand.
Feel free to pick up the phone to us. Like, there's about 5 or 6 different schemes that we operate. You know, there's treatment abroad scheme, cross-border directive, the EHIC, the European Health Insurance Card, and there are a number of E106s, E104s, lots of other schemes. Pick up the phone to us at any time. We'll talk you through what situation you're in and what you're trying to get around. Please do not leave Ireland under any circumstances to go anywhere without travel insurance. You know your little EHIC card, European Health Insurance Card. That's great if you get ill or injured and you have to go into hospital. But I'm going to give you a scenario that I've had 6 of these in the last six weeks to 2 months, where somebody has gone abroad. They may have had a few too many to drink. They jump into a pool. They hit their head, break their neck. Their EHIC covers their hospital treatment, but that EHIC will not get you home. So you are stuck abroad unless you can foot the bill for an air ambulance to get you home, and we're talking anything between 10 and 100 grand, depending on where you are. And if you're not in Europe, your treatment costs won't even be covered. So please, please don't go anywhere, and don't let anybody belonging to you go anywhere without an insurance policy. Check the detail on your insurance policy. I've had a J1 student who's gone to America. I've had a couple of these that have been so similar. He jumped into a pool, broke his neck, had to be airlifted home. But because in paragraph 20 of his J1 insurance, it didn't cover him if he was under the influence of drugs or alcohol. He was uninsured, and his family have bills of 300,000 plus in America. So they've got the air ambulance costs to come home and the cost of the treatment. You are not covered for any of those by Ireland if you're abroad.